Welcome to the Beyond the Blade podcast. We are very excited to welcome two of my nurses here from Zuri Plastic Surgery. This is Jasmine and this is Alessandra. And so both of them are going to help us navigate some of the waters regarding the pre-op portion of a patient's journey at our practice. This is a very important discussion topic that we want to bring to everybody who's listening to us. Even if you're not one of our patients who's coming for surgery, it's important to at least know what the pre-op process is like, what's expected of the patient, and also what kind of information we're going to be providing to you. So both Ali and Jazz are pretty much the primary nurses that handle all of our preoperative preparation for our patients. They are the nurses that will be working with you when you come to our practice, and they will be helping to guide you through the experience of the consents, the preoperative instructions, answering all of your questions, and discussing all of your concerns and clarifying all of those questions. Now, it's important to know that depending on the surgery you're having performed, your instructions will be according to that procedure, and also that the consents will be specific to that operation. But in summary, what we want to do is answer a lot of the most common questions that our nurses are getting every day when they're evaluating patients. And we'll start with Jasmine, and Jasmine can maybe give us maybe her top 2 or 3 most commonly asked questions, and she can give us tips on how to improve the preoperative experience and how to prepare for that before you arrive to the practice so that you're already ahead of the game. And that's the whole purpose of the podcast, is to help educate everybody and to just make it a smoother experience. And then Ali will do the same. She can bring in some of her experiences with some of the patients that she's helped along the way. And then we'll answer a couple of questions that we've gotten through Instagram recently regarding the pre-op process. And hopefully this is going to be a very informative and educational experience for our listeners. So if Jasmine wants to start.
Okay, perfect. So basically, I think before surgery, you should do a lot of research. We start off by sending patients an email with a lot of information, and we provide a lot of resources with videos, a regimen on iron, a regimen on protein, what we should be consuming and avoiding before your surgical procedure. You're going to be basically reading all of your instructions prior to the procedure for the preparing for surgery that's provided in your email by one of our medical assistants. And then that's basically when you get scheduled for a pre-op. You come in and you meet Ali and myself, and we guide you to do the pre-op. We provide you with instructions based on your procedure. We teach you how to use a drain if you have a drain, and a lot of helpful things. We're going to answer any of your questions that you might have, go over your medications, teach you how to take your medications, and find the appropriate pharmacy for you. A lot of this pre-op is educational. We want you to bring your caretakers if you want to bring one of them, so that we can go ahead and go over your instructions with them, teach them how to use the drain as well, teach them how to administer your medications. And then when it comes to the top questions, I would say a lot of patients ask us about what to expect as far as pain. I think that's the top question, how much pain to expect after surgery. And this is all dependent on what procedure you're having. We have a pain package available in the office as well that we highly encourage all of our patients to have. But pain is subjective. Everyone's pain tolerance is very different. So we just have to be very, conscious of that. And if you've had surgery before, it can be completely different because every procedure is very different. Every experience is different. But we do promote our pain package that Dr. Z has other podcasts on, and we have a lot of information about it. But that would be the top question that we get about,
Yeah, I think pain is a very important topic to discuss, and we have a whole other dedicated podcast on our Spotify feed. If you look up the talk with Exparel. Exparel, if you've never heard of it, is our 3-day long-acting non-opioid, which means no narcotics, medication that is phenomenal. And we use it in all of our surgeries, and we're able to use it in liposuction and in all the different types of abdominoplasty, breast lifts, facelifts. And it really helps our patients, really control their pain for the first 3 days after surgery. And after that, most of our patients don't have to take any narcotic pain medication, and they're just taking Tylenol pretty much after that. So it's been an amazing addition to our practice. And we also combine 2 other medications with the Exparel, which is gabapentin, and we also include Ofirmev, which is intravenous Tylenol. So everything that Jasmine said is very important to note. And then, we're going to ask Ali also, what her experience has been helping the patients.
Okay, so personally, I think your pre-op is super important to the whole surgery process. And we want you to come in kind of educated, kind of what you're going to expect. Because we like when you get in there and you have questions for us, you kind of have like a basic idea of what you're getting into, and we can kind of go back and forth and kind of talk about that. I do think it's important to prioritize your pre-op. You should definitely come in there with the mindset that this is the day that you're going to learn everything that you need to know. So we definitely want you receptive, asking questions, listening, kind of being a sponge on that day. It's super, super important. And then I definitely think just asking questions and being interactive with us, it's kind of like we feel good when you're listening to us and you're giving us feedback, and it's not like we're just reading a whole list of things to you and you're just sitting there. So we do like when you're interactive, and we feel like we've done our part in educating you guys.
Yeah, it's supposed to be a back and forth. It's supposed to be a conversation. We don't want to just rattle off all of this information to you. We want you to engage, and we want you to be a part of the experience, because this is very important. This is your pre-op. Like, this is for you. And we spend a lot of time preparing our staff and our nurses to be able to give you the best experience. And in order to do that, you really want to come in prepared. And now there's so much information on our website that we've curated, that we've edited, that we've reviewed, to give every single patient at least some sort of understanding about what's going to happen. But this is your opportunity. This is your time to really absorb all of this information, to ask questions. And that's why, as Jasmine mentioned, it's important to bring a caregiver sometimes, because a lot of the things that we may say, you may not remember the next day because of just the normal stress and the normal anxiety that's related to any surgical procedure. And this is not just about plastic surgery. It can happen with any type of surgery or any type of situation. So we're going to go to 2 of the questions that we were sent through Instagram, and let's see if we can answer these. So have you ever changed a patient's surgery last minute? For example, from a tummy tuck to high definition liposuction, for example. That's a very good question. We actually get into that scenario every now and again, where we meet a patient in person. They haven't had a chance to come see us maybe for a consultation because maybe they live very far away, and they sent in their photos. And, based on the photos, we give them our best assessment, and I let my staff know, and I let the patient know, hey, this is what I think is going to be best for you. But then when you come into the office, sometimes your photos are not exactly what we're seeing in person. So that requires us to kind of refocus, kind of put the brakes on, and then really have a conversation with you at that moment about what your goals are, what do you want to accomplish, what can we do to help you, what is your anatomy, and what is actually possible. Because as everybody should know by now, plastic surgery is not magic, and we have very strict limitations on what we can do based on safety and based on logic. So yes, we do sometimes have to change the procedures at the last minute. It's not a big deal, but it's not ideal. It's not what we want to do. It's not what we don't want to have to change things last minute. But you need to be flexible as a patient. If you're coming in and you've never come to see us in person before, that the plan might change somewhat. And so you need to be prepared for that mentally, financially, emotionally, psychologically. You need to be ready for maybe a little bit of a change, the day before surgery. And that's okay. And that's fine. And we're here to help you navigate that. And we're here to help you, just move forward and make the best decision and select the appropriate operation to get you the best results, all while maintaining safety as your number one priority. So yes, the nurses many times, due to their vast experience and the number of years that they've been working with me in plastic surgery, they will automatically, be able to tell, hey, look, I don't really think you're a good candidate for a tummy tuck, or I don't really think you're a good candidate for a breast lift at this. Maybe you're just a breast augmentation instead of a lift. And so they will always bring that to my attention, and I will always go and see you and talk to you and just review the plan and make sure that you're on board. All right. Do you guys want to add anything?
I mean, it does happen before in pre-op. We have the best intentions for you to have the best procedure in your case. So there are many times that we just bring it up just to get that confirmation and make sure that, you're getting the right procedure.
Yeah.
I agree. I think if you're coming into pre-op and you have any doubts, to bring it up at that moment where we can actually address it and find a plan that fits best for you. We don't want to change the whole procedure, but I think it's best that you feel comfortable and that you're confident in what you're going to be doing the next business day or next day.
Yes, absolutely. Okay, next question. How long after an arm lift can you use your arms again? When can you lift children? When can you drive? So arm lifts and thigh lifts are very delicate procedures. My staff knows that we really take a lot of meticulous care when it comes to these procedures, because when we're removing a lot of skin from a circumferential structure and you're moving your arms or moving your legs, you have a higher risk of wound healing problems. And the way we try to prevent that is now by adding a fantastic wound healing device called Prevena. And Prevena comes from a company called 3M, one of the biggest medical manufacturers in the nation. And they have an FDA-approved wound vac system or incisional suction system that is phenomenal for all different types of wounds, not just arms and thighs, but for arms and thighs especially, it is very important to consider using. So you're going to be able to start lifting your children and start doing that kind of physical activity about a month after surgery. Okay, you want to just be very careful, let everything heal well. We would keep the Prevena on your arms for at least 7 days. And then after that, we would remove it. You're pretty much driving at about 72 hours. You can drive with the Prevena if you would like to, if you have to. But most people want to wait to drive until they take off the Prevena, until they take off the device, and then they're going to be a little bit more flexible and a little bit more mobile. All right, so I think we covered a lot of topics for the pre-op. Please arrive on time for your pre-op. I think that's one of the other major things that we have. Everything is very tightly scheduled at our practice, okay? Every minute counts, and we want to respect everybody's time. So when you have your pre-op, please arrive in a timely fashion, and we will be more than happy to spend all the time you need to help you out. So thank you so much for listening to this edition of the Beyond the Blade podcast with Jasmine and Ali as our nurses, and we hope to have you join us for the next one.